Hey everyone, Aaron from Perfect Postures. I wanted to just follow up the last, basically last episode of chronic pain. And this was something that was on the Today Show. This is back actually in October, and there was 3 areas. They focused on the low back, they focused on the shoulder, and then they also talked about the knee. So what I'd like to do is kind of expand upon why people suffer from chronic pain, or how to prevent future injuries from occurring. And some of the things that they talked about, they got more into the diagnosis or the actual official site of injury. What I'd like to talk about is some of the mechanics behind those injuries. So we talked about the back, which was episode 1. Episode 2, we talked about the shoulder. And again, we talked more about the mechanics behind it. So a lot of times when people have pain, there's a reason for it. It's not just because, oh, I was diagnosed with, say, knee pain. It was patellofemoral dysfunction. There's usually an underlying cause for that. And here at Perfect Postures, our expertise really is, number 1, identifying what the underlying cause is, and then coming up with a corrective series of exercises to actually address some of the muscle imbalances, and then also address some of the joint dysfunctions that occur that basically pertain to the injury. So with the knee, it's been a month again, but I believe they talked about knee injury, and a lot of times they talk about, and one of the most common we hear, especially with sports, is the ACL. With the ACL, a lot of times they'll do a repair if there's a complete rupture, or if there's even a partial and they're a really elite athlete, they're probably going to have to get it surgically repaired. But what they didn't talk about was, again, the mechanics behind that. And a lot of times, unless there was a traumatic injury to the knee, if it were just, say, let's say an athlete was just cutting a certain way toward one direction, and as they were cutting, the knee blows out on them, or they were going up for a pass, let's say, and they were coming down, they came down really hard at an awkward angle, and their knee blows out. Well, a lot of times there's a mechanical side to that, and some of the things that it could be is, as the person was loading on that foot, there might have been too much rotation of the hip. And when I say hip, it's not the pelvis, it's actually the femur bone and how that comes up into the pelvis here. That whole bone might have rotated too far in, which put excessive stress, and then the person ultimately ended up with an ACL injury, and usually that accompanies that is like a medial meniscal tear on the inside of the knee here. So that would be one example. If you want to look even further beyond that, which what we do here, we may look at maybe the pelvis. Maybe the pelvis was actually rotated a little bit left to right, so that when the person was landing and they were trying to absorb that energy and kind of decelerate or stabilize, they couldn't, because their center of mass was actually bringing them toward that side. So if the person was rotated left to right, meaning that the left side of the pelvis was forward, and they're exerting energy into the ground, they can't decelerate because that center of gravity is actually being displaced that way, which then puts more torque into the knee. So those are a couple examples. So if you do have a knee injury and you wanted to kind of look beyond that, this is definitely something that you should look into. So stay tuned. Usually tell people, if you have questions, right, just shoot me an email, post on our Facebook page, whatever you'd like to do. And if there's a specific area that you want to talk about, feel free. I'd love to do it. Thank you. We'll see you in a week or 2. Thanks.